There is hope, and the church joins together to bring this good news to the nations of the earth. I've worked in HIV education since the early 90s, and those first years were really difficult. There were so many people who were sick, and there were so many people who died from AIDS without any kind of treatment. It was a really hard time, but it was also a very powerful time. It was really a privilege to be in Africa in those years and watch how churches responded to the needs of people in their communities who were living with HIV/AIDS, to watch them respond with compassion towards the families who were also affected, then just to watch them as they took on the challenge of talking about prevention. We were talking about HIV in those days. Prevention was all about making good decisions concerning sexuality, and that is always a difficult topic to take on, but they did. And it was a very effective way for them to reach out to the needs of the people in their communities. When the nations of the world joined together and said, there has been enough sickness, there has been enough death, we're going to do something and put an end to this. Well, when they did that, things really did begin to change. And now we are actually living in a period that's called treatment for all. And so according to international protocols, a person should be able to start HIV treatment within 30 days of their diagnosis. So this keeps their immune system strong and healthy for many years to come. Millions of people with HIV are on HIV treatment, and this extends their lives for many years. A person who stays on their treatment, takes it correctly every day, is now able to live as long as someone who does not have HIV, but it also prevents them from passing the virus on to other people. I worked with a man who had become infected with HIV through the use of needles to inject illegal drugs. And I remember the first time that he came to talk to me, he was weeping with regret for what he had done, and he was so afraid that he was going to pass HIV to his wife. He loved his wife, and I encouraged him to start treatment, which he did. After 6 months, the amount of HIV in his body was so low that he didn't run any risk of passing HIV to his wife. And I remember he was so thrilled that treatment had actually worked for him, and he wasn't afraid that he was going to hurt his wife anymore. And I was just really proud to see this man take on the challenge to take treatment, to do it correctly, and he did it out of love for his family. In order for treatment to be effective, it has to be taken every day, exactly as ordered, for life. That's a big commitment. It's a really big commitment. My dream is to create a network of peer educators who will provide HIV support, education, and coaching to leaders and staff living with HIV infection in Russian-speaking alcohol drug rehabilitation centers. And it's a really big dream because the epidemic is spreading very quickly in Russia and those nations that speak Russian. But I really believe that God's heart is to see these people live long lives, to live healthy lives, to take care of their families, and to continue the ministries that He has led them into. So it's a big dream, but I believe it's possible, and I believe there is hope, and the church joins together to bring this good news to the nations of the earth.